You know where firm is diaphragm, light is bell. So that's what I would do with that. Listen, that's 10 times listening. I'm not counting anything, I'm listening to the regularity of the heartbeat. And then at the end, if everything is, quote, normal, don't use that word, I'm going to say S1 and S2 auscultated. S1 loudest at the apex, S2 loudest at the base, okay? No abnormal heart sounds or murmurs auscultated. Gotcha? Okay. Now, I finished with that, and now I will tell you this, that most of you, if you have women, you're going to want to have laid them down for that. I did not because our bed is kind of broken, but you would probably want them to lay down. Now the one thing, you know, I said I forgot something. Oh my gosh, all of a sudden I remembered it. So I'm going to act like I didn't forget anything at all. Now I would like to check your oral mucous membranes, please. Ashley, if you would open your mouth, please. Okay, you have to use the flashlight or you lose points. Let me look up. Can you raise your tongue up for me? All right, sounds good. You do not have to wear gloves if you're not going to stick your hands in their mouths, okay? But you do have to use a flashlight and a tongue depressor. Those will be provided for you. Okay, what I'd like for you to do, Ashley, if you would, I'm going to listen to your abdomen. It's a little easier to do that if you are laying flat. So if you would just scoot down so that you're flat, and this will be the end of your bed. Just put your feet out there, okay? That's good. You have sheets and blankets on the beds. So you're going to pull their gown up, but also pull their sheets up to provide for privacy. You'll have a bare abdomen here, okay? They're aware of this, okay? This is not shocking to them. If their pants are right across the umbilicus, then you'll need to move your stethoscope. All we're going to do is listen today. And so you'll need to move your stethoscope right underneath the belt of the pants down into the lower right quadrant. You're going to stand on the right side of the bed and you're going to listen until you hear something, okay? So I'm listening here. Now, if you listened to the heart with the bell last, it is entirely possible that you forgot to turn the bell around to listen to the diaphragm. So if it's like quiet like the grave, look at your stethoscope and see, because your instructor, you know what they're looking for? They're looking for that dot or whatever it shows on your stethoscope that you can hear, okay? So if they see the dot with the bell and they're thinking your stethoscope's upside down, okay? And they know you can't hear anything. So make sure that you can hear. So I'm going to listen. A little faster. So I would say, you know, read your book about hypoactive and hyperactive vowel sounds, or they're normal active. In this case, I'm going to say that you have normal active vowel sounds in all 4 quadrants. All right. Now what I'm going to do is I'm going to move to upper body now. I'm going to check for temperature. I'm going to touch you for just to see if, oh, warm. Look, not on clothes, but on skin, not with gloves because I can't feel. Warm. Hands are a little cooler by lad. So I would remember the words by lad. I'm going to chart your skin tone is light tan. You have some scattered freckles. Your body temperature, upper body is warm by lad on the arms, except for the hands, which are cool by lad. Okay? I'm going to feel your elbow here. Okay, I don't feel any crepitus. I'm going to run her through passive range of motion. Now she can be seated up for this, or she can still be down. So just relax that, no crepitus, and there we go. So I want you to do that for me. Would you straighten out your hands and turn them over for me? Turn them back. Okay, and now I want you to put your hands like this, okay? Okay, I want you to push against me, okay? And I want you to pull against me. Okay, so muscle strength by lat on the arms is 5 out of 5. Now, if I didn't want to do that muscle strength, I could ask her to squeeze my fingers with both hands. Squeeze it hard. Okay, 5 out of 5 by lat. Now, you don't have to do both those for muscle strength. You can do one or the other, okay? Now, I'm also going to check if I decide to do this while she's laying in bed and, oh, sorry. I was a little disorganized there. Radial pulses. Do them at the same time. Okay, I would say that your radial pulses are +2 out of +3 by lat. And now I'm going to check your cap refill on all 10 fingers. Cap refill, less than 2 seconds, 10 out of 10. I can move to lower body. Feel the temperature. Okay. I am going to check for pretibial edema. Press for 5 seconds. See if, when you take it back, if the skin remains indented or does not immediately return to its proper position. If there's any lag, then there's edema, okay? I am going to feel for pedal pulses. I can do either the dorsalis pedis. You are supposed to do pulses with both hands at the same time. I told somebody sometimes I can't concentrate like that, so I find it with one, and then I put the other one down and find that one, and now I've got them both at the same time. Do not look. You can do posterior tibial if you want, and they are on the inside. If you start going to the outside, we know that you're not finding anything. We just sit there and watch you, okay? So they are to the inside of the malleolus. So if you haven't found those yet on people, you need to start looking. Now, because you're laying down flat, Ashley, I can ask you to point your toes to the sky against my hand pressure, okay? Or I can ask you, point them up for me, and now push against. Okay, so muscle strength is 5 out of 5, and that's one way to check muscle strength. And since you're sitting here, I will check your cap refill on all 10 toes. If they have toenail polish on, or fingernail polish, you're always going to use the tips of their toes, okay? So, cap refill is less than 2 seconds times 10 for the toes. Now, Ashley, if I can help you out, I need you to go to a sitting position, please. And scoot your legs off the side. Now, I could have done this all while she's, for the legs, all while she's sitting on the side. And if so, I would probably, I find it easier to do the pulses while she's laying down. But I want you, this is the opposite. Press your legs against me, please. Okay, and pull them back. So muscle strength is 5 out of 5. Now, what I can't do while she's laying down is just let your legs go loose. I'm going to check passive range of motion. No crepitus. No crepitus. And now if you would you extend your feet straight? Now bend them back as far as you can bend them. Okay, so she has full range of motion with her lower extremities, with the knees, and that's full range of motion by lat with no crepitus. Muscle strength 5 out of 5. How's my time going?
9 seconds.
9 seconds. Well, I don't have a lot of time, but if you have a minute or so left, we furnish this blank page, which you can use at any time. It's blank, but it does have the overall things on it, and sometimes that helps you just think about what's there, okay? Since my time is up, if you still have time and you've looked at this and you can't remember anything that you want to, we will let you actually look at the grading sheet, not the one we filled out, but a blank one, and then anything that you remember from that you didn't do, you get half credit for. Remember that this is just a practice one. The one that you have to pass is the one at the end of the semester. This is like a trial run for you. The one at the end will change a little bit, not a lot. We'll take some things off and add a few things on that you've learned in the second half. Okay, so let me have it.
I didn't get anything except the reporting, the observing, the signs and symptoms of distress.
Oh, man, I meant to do that. When she had pain, how much did I lose for that? You know that appears in no distress?
1 point. I made a 99.
That's better than yesterday. Okay. But you see, I didn't do everything quite in order, did I? Oh, because I forgot something. I forgot that mouth thing. I knew there was something. I just had a feel for it. And I just felt that it wasn't quite right. And then I looked down. And those tongue depressors will always be on the table. Okay? The hand hygiene is always on the table. If you forget, then wherever you are, find a good spot and then pick it back up again. Okay? Or you can pick it back up at the end if you can remember it. But we're good at the grading sheets, okay? So we can kind of follow. Now, if you are all over the place and totally disorganized, we don't follow that well, and we don't grade that well. There's a spot at the end that talks about what is it? Were you professional? Were you organized?
Consistent in reporting your findings.
Consistent?
Exam is organized, logical sequence, professional demeanor, correct terminology, and privacy.
Yeah, and in that 9 seconds that I had left, I'd put her back in bed, put her bed down, give her call button, and do everything for safety. Or I lose points on that. Okay? Questions or anything? Yes?
How many points do you lose if you don't finish in time?
You lose every point that you didn't finish.
Okay.
Yeah. And mostly, it's usually, the reason people don't finish in time has to do with how they talk to their patient. It's going to be a little nerve-wracking because you're doing it by yourself, you're not doing it with a friend, you're doing it in front of your instructor, and you're doing it with a stranger. And so you will want to talk to them. And I've seen students talk to them for like 4 minutes before they get started. So you have to move and talk. So when you practice, you can...
She did both procedures. You guys are not going to be doing them.
Yeah. And so you see, you can cut some time out, but you only do one upper strength and one lower strength, whichever. But can you see how if I just let her lay flat there for a while, I figured she wasn't too uncomfortable. But if I wanted to raise her up to sit, I'd have to raise the bed up. You see how that takes time? So think about how you organize what you want to do. Do all the sitting up stuff. It is easier to listen to the heart laying down. And then you move right to the abdomen and it's already flat. Okay? And then you can set them up and do upper body to legs. It's easier, I think, to do the pulses when they're laying down, if you can remember. Because when I do them down here, what's happening? I push and her feet are moving back and stuff. So I don't get good feet pulses because they're moving all the time. Little things, okay? All right, I'm done.